Hello and welcome to our show Health and Wellness Myths versus Facts. I'm Gargi Rawat. Healthy women make a healthy world is a popular statement, but do women truly pay attention to their health? Because of their multiple responsibilities, women are often preoccupied with their spouses or children's health while neglecting their own. Women's health differs from that of men in numerous ways. Although women in advanced nations have closed the gender gap in life expectancy and now live longer than men, they still suffer from disease early with significant mortality outcomes in many areas of health. Women's health is determined not just by their biology but also by situations such as poverty, job security and family support. Now, in recent years, there has been a significant surge in concern about women's health. The recent lifestyle modifications of today's women have been attributed to an upsurge in diseases. The prevalence of metabolic disorders is increasing in women, and the need of the hour is to adopt the easiest strategy of prevention. Prevention means an early diagnosis and a timely and effective treatment. We have with us an expert panel to discuss these concerns regarding women's health. Joining us, we have Dr. Surekha B Shetty, MD Internal Medicine, Bangalore Medical College, Karnataka Institute of Endocrinology and Research. Thank you so much, Doctor, for joining us. If we can just start by asking you about women's health, and women experience unique health issues and conditions from pregnancy and menopause to other gynecological conditions. Now, these cause hormonal variations and could predispose women to more health challenges. So if you could tell us a bit about this.
At the outset, I would like to thank NDTV for this initiative on women's health. The focus needs to be on women now. It's a well-known fact that women and men have different health dimensions, and probably that has given rise to the saying, men are from Mars and women are from Venus. Women's health goes through different variations because of the hormonal dimensions that she undergoes from puberty to menopause, and her physical, emotional and social well-being probably depends on her hormonal biology and also her socio-cultural and environmental emotions. So essentially, we need to look at this aspect while we diagnose and treat various disorders in her life. The hormonal changes during puberty, pregnancy and menopause predisposes her to specific health conditions including diabetes, heart disease, cancers, autoimmune diseases, osteoporosis, arthritis and so on and so forth. Gender not only determines the vulnerability of a woman to certain conditions, it also decides the health-seeking behavior of these women. It has been said that women are often under-researched, under-diagnosed, under-treated and under-supported during her recovery from any illness. To highlight on these, there are certain conditions that occur both in men and women, but probably little differently handled in women. Like for example, diabetes. Children with diabetes, you see that girls, when they undergo pubertal surge, they have difficulty in controlling their blood sugars well, eating disorders, estrogen surge, growth spurt, all these could contribute to her uncontrolled diabetes. And then women, many of the women can be subjected to a condition called as polycystic ovarian syndrome. This not just causes various menstrual irregularities, infertility, weight gain and excessive hair growth, it also predisposes her to long-term health conditions like diabetes, dyslipidemia or heart disease. And secondly, polycystic ovarian,
Right. Well, we're also joined, and to talk more about diabetes, we're joined by Dr. Sneha Nikte, diabetologist and physician. Dr. Sneha Nikte, Diabetes and Thyroid Obesity Clinic, Mumbai. Thank you so much, Doctor, for joining us. And speaking about women's health and issues that they need to look out for, you could tell us, what is gestational diabetes, what causes it, and does it make women more predisposed to developing diabetes post-delivery?
Thank you so much, Gargi. A very warm good afternoon. Dear friends, gestational diabetes mellitus is an important factor. It's also known as pregnancy diabetes. And this is a condition which is generally seen throughout the pregnancy, diagnosed in the early pregnancy, if in case in the first trimester or maybe in the second or third trimester. The pregnant lady is predisposed to getting diabetes in the future. The risk factors would be the intake of, sweet, the sugar intake would be more on the higher side, diagnosed generally around 20 to 24 weeks of the gestation. and brings a lot of risk to the mother and the baby. During the delivery itself, the baby is at risk because of the increased weight, and this all happens because of the hormonal imbalance that happens due to the interplay of the pregnancy hormones as well as the insulin. And the risk of getting type 2 diabetes is definitely higher in the females in the future.
All right. And Dr. Surekha, what steps can women take to reduce the risk of gestational diabetes? And also, in case they do get gestational diabetes, how can they better manage it?
That's an important question. It is difficult to say accurately who would get gestational diabetes, but there are certain risk factors that have been identified, especially if a woman gets pregnant above the age of 25, if she is obese, if she has family history of diabetes, if she has conditions like polycystic ovarian disease, or if she had any history of abnormal sugars in the previous pregnancy, she is at higher risk of developing gestational diabetes. In presence of these risk factors, maintaining ideal body weight with the help of healthy food habits and being physically active is an important strategy. Of course, if these risk factors have been identified in any woman, it becomes important to check the blood sugars before planning pregnancy. Probably all women today would like to plan their pregnancy, and during this planning, blood sugar check should be one of the important parameters. Also, gynecologists will check your blood sugars at confirmation of pregnancy and at also 24 to 28 weeks. And if you have been diagnosed with gestational diabetes, it is very important to keep the sugars under control at throughout the pregnancy. This is important to reduce the risk of complications.
All right. Well, let's talk about other issues that are facing women. And Dr. Sneha, one of the bigger issues that we hear, it's become very common these days, is PCOS and PCOD. So what is the difference between the two, and what are the causes for it? Also, what steps can be taken to reduce the risk of getting them?
Yes, Gargi, as you rightly said, we see the huge amount of patients suffering from, especially the young females, suffering from PCOD, which is nothing but the polycystic ovarian disease, whereas PCOS is the polycystic ovarian syndrome. So where we use the term syndrome, it is a constellation of several other things apart from PCOD. So the major difference being PCOD per se is an entity, whereas the PCOS is a syndrome. In PCOS, we see a severe form of PCOD, as along with that several other things like hypertension, obesity, and so on and so forth. A lot of factors contribute towards PCOS. To manage, if you see, PCOS is per se very difficult and irreversible, whereas PCOD can be managed. The best way to manage PCOD or PCOS is to keep the weight under check, maintain a good healthy lifestyle. So per se, a good lifestyle modification along with the treatment through a gynecologist and the endocrinologist will help the women to get over with the PCOD. Infertility is the major dreadful complication of PCOD or PCOS. Also, several other factors like hypothyroidism or hyperprolactinemia, these are the factors which would be coexisting in the PCOD or the PCOS females. And it's indeed major lifestyle disorders. We see females as young as 13 or 14 suffering from PCOD nowadays. So it's definitely becoming an alarming lifestyle issue owing to our very fast lifestyle. Over to you, Gargi.
Right. Dr. Shetty, anything you'd like to add to that? And this point about if a woman is overweight, losing that weight will help her better manage these lifestyle diseases like PCOS and type 2 diabetes.
Yes, of course, Gargi. Body weight is one of the important determinants of multiple metabolic disorders that we see nowadays. And there is various definitions used for classifying body weight. And overweight or obesity is defined as excessive fat accumulation in our body, leading to multiple health disorders. So our clinicians measure the body weight and use it to classify the body weight categories. And this is one of the simplest way of doing it is measuring BMI, body mass index. And worldwide, body mass index above 25 is classified as overweight, and more than 30 is classified as obesity. But in India, it is noted that we at lower body weight itself could have multiple health disorders. And that is why it becomes important for us to concentrate on weight reduction. And weight reduction comes with its own benefits. In situation of PCOS, it is noted that 5 to 10% of body weight reduction could reduce multiple components of PCOS, like it restores ovulation, improves fertility, regularizes menstrual cycles, and also reduces the risk of diabetes in the later date. With regards to type 2 diabetes, studies have shown that body weight reduction by 10% could reduce the risk of developing diabetes by almost 50%. Last but not the least, reducing body weight with healthy food habits and exercise is the most cost-effective way of maintaining your health.
Dr. Sneha, women frequently suffer from vitamin D deficiency, and this may result in brittle bones. Does it also have a relation with an increased risk of diabetes?
It does, Gargi. Basically, we need to establish a link between vitamin D deficiency and diabetes. So to understand this, I'll just give you a context. See, basically, vitamin D deficiency predisposes more of insulin resistance, which is the major causative factor for vitamin D, for the diabetes mellitus. So whenever there is a vitamin D deficiency, we see these females are more predisposed to get osteoporotic fractures, the weakened bones. The term osteoporosis means the weakened bones, and we see huge amount of cases of osteoporosis because of vitamin D deficiency, where the diabetes also coexist. So it's basically the inadequate exposure to the vitamin D, which is also called as a sunlight vitamin, because the best source of getting vitamin D is either through the sun exposure or through the food. So I suggest people should basically females should make sure that there is a adequate exposure to the sun. Also, the food intake, the food items which are rich in vitamin D should be consumed, as in mushroom, broccoli, couple of nuts, then seeds. These are those things which have a huge amount of vitamin D in them. So these are the risk factors. If we can identify very well in time, we can definitely work over it. Also, the nutritional supplements and the medical treatment, that is vitamin D supplements, can be consumed by the females to avoid this osteoporotic fractures in the future. So vitamin D deficiency and diabetes per se can coexist in females, and it's very common these days.
All right. Well, thank you so much for that. And, we'll slip into a short break now. You're watching Health and Wellness, Myths versus Facts, and we're focusing on women's health today. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and today we're focusing on women's health and various issues that women face. Let's now talk about heart attacks or heart disease in women. And Dr. Surekha Shetty, now it used to be believed earlier that women were safe from heart attacks and heart disease. What is the prevalence of heart disease in women now, and is it correct that women after menopause tend to get most heart disease?
Well, this is what the popular belief has been, but contrary to the belief, heart disease is the #1 killer in women, and in fact, year-wise, more women are dying of heart disease than men. The hormonal effect on the prevalence of heart disease has been something that has been studied extensively, but we still don't have a clear answer, and the verdict is yet out. Conventionally, it has been believed that estrogen is heart protective because of its beneficial effect on the blood flow, on the cholesterol levels, and also on the oxidative stress levels. But the occurrence of heart disease is not so simple, and there are multiple factors, risk factors involved in development of heart disease, and many of which could be different in each person. Obesity, family history of heart disease, smoking, stress levels, physical inactivity, diabetes, all these factors could add to the occurrence of heart disease in women. Of course, it occurs almost a decade later in women, and that is why this myth that women are protected from heart disease. Of course, the presentation in women could be different from men. The risk factors could be different. The treatment outcomes could be different. Commonly, chest pain is the most common symptom of heart disease, but women may have some non-specific symptoms which makes the presentation to the hospital little delayed, and that is why diagnosis also delayed. And it has been said that usage of preventive aspirin or statin is less in women compared to men. The outcome of surgery for heart disease like coronary artery bypass seems to be little more complicated in women, and women tend to have higher risk of developing stroke after having heart disease. In summary, though Women are told to be protected from heart disease before menopause. It may not be completely accurate. The pathophysiology is complex, and that is why women need to look at the risk factors and address them in their daily life so as to protect themselves from heart disease.
All right. Well, let's know more about how women can protect themselves overall. And Dr. Sneha, if you could tell us some, some good tips to manage women's health in order to have a better life.
Yeah, Gargi, the gist of everything is women have been neglecting their health, in order to take care of the families. The women have been toiling hard and have been always neglecting their health checks, their follow-ups with their doctors, their appointments with the doctors. So I think the time has come to be aware of all these factors, to take the health seriously, to take the vaccine seriously. How can we even forget about the HPV vaccines, which we can start for our daughters and our granddaughters, and start at the earliest. And then there are screening methods to prevent the dreadful cancers like breast cancer. So we can the women can undergo mammograms, the sonomammograms. Then further there are HPV vaccines, then cervical cancer screening, pap smear methods. These are a couple of things which women should never ever neglect. Then comes the major part of modifying the lifestyle, where the two arms of lifestyle being the diet and the workout. By any means,
Right.
the 30 to 35 minutes dedication, would definitely take you a long way. So I think these are a couple of factors which we always, should take care of.
Right. Dr. Surekha, is there anything you'd like to add to that? We're running out of time, but quickly, if you could add something to that.
Yes, of course. I think charity begins at home. Women need to maintain their health so that they can take the responsibility of their family and of the society. And the focus has always to be on the healthy lifestyle, which includes healthy food habits and being physically active. Of course, as Dr. Sneha pointed out, we need to focus on some of the health screenings beyond certain age, focusing on mammogram, pap smear, and bone density screening. Last but not the least, I think what we need to understand is that women tend to neglect themselves, but we need to focus on our health so that we can contribute to a healthy society. And that is why the focus today on women wellness, prevention is always better than cure.
Right, absolutely. And don't neglect those, checkups with the doctors and the various tests that one needs to get done as one gets older. Thank you so much, doctors, for talking us through all this and telling us, all about women's health and how to better protect your health. Thank you for joining us on the program. Thank you all for watching at home.
Thank
Goodbye.
you.